ladies and gentlemen, welcome back to the channel. It's my take on it with Dr. Victor Obasuyi. And today, I'm going to be talking about a very important issue that I see at the clinic frequently, and that's red eyes. A lot of patients come into the clinic, sometimes a little late. When you have red eyes, it is very important to have it checked as soon as possible. The eyes does not just turn red on its own. Whenever the eye is red, it means the eye is telling you that there's an aggravating factor that shouldn't be there. What are some of these factors? Sometimes it could be just allergy. If you find that the eyes are red and very itchy, which is usually the first thing that you will find in allergic conditions. But if it's just one eye and it's red and itchy, obviously that cannot be a case of allergy, because you don't open one eye when you move around. So whatever you're allergic to in the environment will most likely affect both eyes at the same time. Again, sometimes you find the eyes are red and there's mucus discharge. Like you wake up in the morning, you see the eyes are kind of glued together. Whenever there's mucus discharge, rule of thumb is that's a bacterial infection. Then if the eyes are just red and watery, then most likely you're looking at a viral infection. But there are times when the eyes are red and it's not an infection. It could be just an inflammation. There are so many things that can cause your eyes to become red. Some of them are trivial, true, but there are some that are obviously very could be very dangerous, especially if there's a pain and the pain is sudden onset and very severe. Even if this happens with kids, I usually tell them or tell the parents, question, on a scale of 1 to 10, how bad is this? 1, insignificant. 10, very bad. That's the way most kids, if they are honest, can easily evaluate how bad the situation is when they complain to you as parents. Based on severity of the red eye, how long it's been ongoing, a lot of times the body immune system is able to suppress or fight these situations. And there's an infection or there's an aggravating factor. The very first thing that the human body does in terms of natural response is to send more blood or pump more blood in that direction. That way it sends more white blood cells, which is the body's primary defense mechanism, towards that direction. So which is what we see as redness, because blood pumps more towards the direction of the aggravating factor to fight it. Coming with blood is the white blood cells. The white blood cells does not flow alone, so there's also the red blood cells, and that's usually then the vessels tend to dilate, and that's why we see redness. So whenever the eye is red, I always advise patients, don't try to mess with it. Seek medical attention. Some will tell you, oh, my brother had red eye last time and the doctor prescribed one eye drop. Suddenly they want to use the same eye drop, or they want to give the same drop to their kids. Your brother may have had bacterial infection, and what you have is a viral infection. Your brother may have had red eye that was due to allergy, and what you have is different. The redness that you are complaining of might be from just regular dry eyes. You don't know. Then sometimes redness could be something worse. Could be like maybe a case of anterior or posterior uveitis. coming from autoimmune problems in the body. So a lot of times, from just the red eye alone, your doctor can send you for other tests that could elicit life-threatening conditions. So it's important at the earliest stage to seek medical attention instead of doing a try and error work at home. I've even seen worse cases where patients they do the try and error at home. Whatever measures they are trying does not relieve the condition, and they keep trying other things. If you tried the first time and you find that what you tried did not work, go to the doctor. You can go to your family doctor or go to your eye doctor. But it is not enough to just keep trying every home remedy that you think might work. Remember that whatever you put in the eyes is direct contact, so you can make situations worse. I just thought I could share these ideas with you guys. Whenever you have a red eye, please don't always presume that it's one of those things, and try to treat it on your own. Worst thing that you can do is to let things go out of hands before you seek medical attention. So thank you, ladies and gentlemen. My name is Victor Obasuyi. I'll see you guys next week. Thank you.